The Medicare Prescription Payment Plan, what it is and how it works, 2026. If you have Medicare drug coverage and you have ever walked up to the pharmacy counter, handed over your insurance card, and been hit with a bill for hundreds of dollars all at once, this video is for you. There is a relatively new option available to Medicare beneficiaries that most people have never heard of. It is called the Medicare Prescription Payment Plan, and it could completely change how you manage your prescription drug costs throughout the year. My name is John. I am a licensed Medicare insurance agent. Today, I'm going to explain exactly what the Medicare Prescription Payment Plan is, how it works, who it helps most, and how to sign up. Starting in 2025 and continuing in 2026, Medicare introduced a new payment option for people with prescription drug coverage. Instead of paying your full copay or coinsurance at the pharmacy counter every time you pick up a medication, you can choose to spread those out-of-pocket drug costs into smaller monthly payments throughout the year. Here is the key thing I want you to understand right away. This program does not lower your drug costs. Your total out-of-pocket spending for the year stays exactly the same. What changes is how you pay it. Instead of paying large amounts at the pharmacy all at once, you pay your plan a monthly bill. Your plan pays the pharmacy on your behalf. You never have to hand over hundreds of dollars at the counter again. That is exactly what the Medicare Prescription Payment Plan does for your drug costs. And here is something that surprises most people. There is absolutely no fee to participate, no interest, no hidden charges. You pay exactly what you would have paid anyway, just spread out differently. Let me explain exactly how the monthly payments are calculated, and because this is where people get confused. When you enroll in the Medicare Prescription Payment Plan, your out-of-pocket drug costs are divided by the number of months remaining in the calendar year. So for example, let's say you enroll in January and you pick up a medication with a $600 copay. For example, instead of paying $600 at the pharmacy that day, your plan calculates your monthly payment by dividing that $600 across the remaining months of the year. Your monthly bill becomes much more manageable. Here is something important to understand though. Your monthly payment is not fixed. It can change throughout the year. Every time you fill a new prescription or get a refill, the new cost gets added to your total and divided across the remaining months. So if you add a new medication in July when there are fewer months left in the year, your monthly bill may go up. This is why timing matters. The earlier in the year you enroll, the more months you have to spread out your costs and the lower your monthly payments will be. Enrolling in January gives you 12 months to spread costs. Enrolling in October gives you only 3 months, which means higher monthly payments. Experts generally recommend enrolling before September to get meaningful benefit from the payment plan. Once you are enrolled, your plan pays the pharmacy directly every time you fill a prescription. You will receive a separate monthly bill from your plan for your share of the costs. You still pay your regular plan premium separately. The payment plan bill covers only your drug cost sharing. Let me connect this to something we discussed in a previous video. The $2,100 true out-of-pocket cap for prescription drugs in 2026. Here is the important thing to understand. The $2,100 annual out-of-pocket cap applies whether you use the payment plan or not. Once your total out-of-pocket drug spending reaches $2,100 in 2026, you pay zero for covered drugs for the rest of the year. The Medicare Prescription Payment Plan does not change that cap. It does not help you reach the cap faster. It simply changes how you pay your costs as you work toward that cap. So think of these two things working together. The $2,100 cap protects you from catastrophic drug costs. The payment plan protects you from large surprise bills at the pharmacy counter. Together, they give you both a ceiling on what you spend and a more manageable way to pay it. Now let's talk about who this payment plan actually helps. because it is not the right fit for everyone. You are most likely to benefit from the Medicare Prescription Payment Plan if you take high-cost specialty medications, things like medications for cancer, rheumatoid arthritis, multiple sclerosis, or other complex conditions where a single prescription can cost hundreds of dollars. You have had a single prescription that cost $600 or more at one time. You have had out-of-pocket drug costs above $2,000 in a previous year. You struggle to afford large upfront payments at the pharmacy but could manage smaller monthly bills. You do not qualify for extra help or other assistance programs that already reduce your drug costs significantly. On the other hand, the payment plan is probably not the right fit for you if you qualify for extra help, also known as LIS, because your co-pays are already very low, and spreading them out monthly adds little value. You are enrolling late in the year after September because there are not enough months left to meaningfully spread your costs. You have secondary insurance or a health reimbursement arrangement that already covers most of your drug costs. The bottom line, if you regularly face high drug costs throughout the year, this payment plan can be a genuine financial relief. If your drug costs are already low, it may not make a meaningful difference. So how do you actually sign up? Enrolling in the Medicare Prescription Payment Plan is straightforward. You have three options. Option 1, call your plan directly. The number is on the back of your insurance card. Tell them you want to enroll in the Medicare Prescription Payment Plan. They are required to offer it, and they will walk you through the process. Option 2, go online. Most Medicare Advantage and Part D plans have an online portal where you can enroll. Look for the Medicare Prescription Payment Plan option in your account settings or benefits section. Option 3, visit medicare.gov. Go to medicare.gov prescription payment plan to find information and a tool that helps you determine if you are likely to benefit from this option based on your specific situation. Once your plan receives your enrollment request, they are required to process it within 24 hours. You will receive confirmation, and from that point forward, your pharmacy will be notified. So the next time you pick up a prescription, you will not pay at the counter. You can also opt out at any time if you decide the payment plan is not working for you. Your drug coverage remains completely unaffected whether you participate or not. One important note, if you switch to a different plan during open enrollment, you will need to re-enroll in the payment plan with your new plan. It does not transfer automatically. One question I get asked a lot, what happens if I miss a payment? If you miss a payment, your plan will send you a reminder. You will not be charged interest or fees, there are none, but if you do not pay your balance within 2 months of the due date, your plan can remove you from the Medicare Prescription Payment Plan. If that happens, you go back to paying at the pharmacy counter directly. You are still enrolled in your drug plan and your coverage is not affected, but you lose the monthly payment option. The good news is you can re-enroll if you are removed as long as you pay your outstanding balance. So, missing a payment is not catastrophic, but staying current keeps your budget on track. Let me leave you with the key points from today. The Medicare Prescription Payment Plan is a free optional program that lets you spread your out-of-pocket prescription drug costs into monthly payments instead of paying large amounts at the pharmacy counter. It does not lower your drug costs, but it makes them significantly more predictable and manageable. You are most likely to benefit if you have high drug costs, take expensive specialty medications, or struggle with large upfront payments. You can enroll by calling the number on the back of your insurance card, going online to your plan's website, or visiting medicare.gov prescription payment plan. And the $2,100 out-of-pocket cap still applies regardless of whether you use the payment plan or not. If you have questions about whether the Medicare Prescription Payment Plan makes sense for your specific situation, drop them in the comments or reach out to me directly. As a licensed Medicare agent, my help is always free. If this video helped you, please hit the like button and subscribe. New Medicare content every week in plain English. I will see you in the next one.